All right, so we're back with another episode of Storytime with Dr. Brown. That's me. And we're going to be taking a deep dive back into history. We can't really understand where we've come from unless we go back in time. And we're going to do that with the help of this Medicine and Pharmacy Review book. It's a pictorial guide, and it provides some history lessons and some images which I think are really striking. And I've always used this as a point of reference. Sometimes when I'm just kind of beaten up and tired, I'll come back to this because it gives me perspective of things. So what we have here is the medicine in ancient Egypt. And we have an image here, and in this is about 18th dynasty. It's 1500 to 1400 BC. And here we see a physician who's signified in a white linen cloth. He's wearing a wig, which denotes his status. And a patient who's sitting in a rock chair with his arms draped. And we see two priests over here and somebody who's actually holding up a papyrus, which the physician reads from to treat the patient. So it's very interesting to see all of this represented here, because if we go back in time, we can have an understanding of what it was like then and where we are now. The roots of the profession of medicine are actually buried far back before the dawn of history itself. The quality or lack of quality of medical care influenced the course of civilizations. Egypt was a fine example for that. And for recorded history, medicine was intimately associated with certain practices of certain groups of people for knowledge and seeking out a better way of life. So way back through about 3000 BC, there were medical interest centers that were founded in the third dynasty. And in particular, the pharaoh Zoser was the one who was responsible for lifting his people up and building a civilization that was founded on science, and medicine was a very important part of that. Imhotep is in particular the one that was regarded as a priest, some as a magician and a poet, but in many of the Greco-Roman writings, he was actually representative of a god of medicine. Medicine that was practiced in ancient Egypt were not primitive. They just transcended certain levels of agriculture, technology, and certainly architecture and even art. One of the founding examples for this was developing diagnostics, and then taking those observations and those diagnostics to then arrive at a treatment for the condition. Obviously, they were limited in terms of some methods of treatment, but they did focus on diet, physiotherapy, and some drugs, although those drugs now certainly have not been founded, but certain ones like castor oil are still used today by physicians, and even some older herbs and treatments that are well founded in folk medicine. In Egyptian practice, you start with, if you examine a man who, then comes the diagnosis, which begins with the words, you should say. This diagnosis then ends with the word, an ailment which. A surgeon might say, an ailment which I shall treat, or an ailment which I shall combat. So one of the fascinating things is all of this has also been transcribed in the papyrus, the Edwin Smith papyruses that were translated. And it's fascinating to look at these perspectives. It's fascinating to see the contribution Egyptians provided to the Greeks, then the Greeks passed down to further generations, Hippocrates forming the school in Kos, Greece, which is the forefather for Western medicine. So that is just one chapter in many. Thanks for joining us. And if you happen to find any of this interesting, or more importantly, if you want to collaborate, check out the link below so that you can send us your comments, any stories you may have, anything, we're happy to entertain it. And this is really about us going on a journey together.